All right, we are getting some breaking news. Tomorrow at 9 a.m., Prime Minister Narendra Modi is going to do a COVID review meeting on the situation in the country. This is going to be an internal meeting. At 10 a.m., he will interact with the chief ministers of high burden states on COVID-19 situation. At 12:30, he will be holding a video conferencing with the oxygen manufacturers in the country via video conference. So the Prime Minister has a packed schedule as far as the planning goes. Tomorrow at 9 a.m. he's going to have an internal meeting on COVID-19 situation. 10 a.m. chief ministers of high burden states will be in meeting with the Prime Minister, and at 12:30 oxygen manufacturers meeting with the Prime Minister. The dire situation that we are seeing all across the country, whether it is the shortage of oxygen or the hospital beds, after a lot of criticism for the government of India and many political parties for having their eyes off the current crisis, being so involved and completely, in fact, as far as the Bengal elections are concerned, now it just seems that the severe crisis has jolted not only the state governments but the central government into action as well. The Prime Minister is now going to do a series of meetings. He has been interacting with vaccine makers and others as well. But this comes at a time when India already almost on a curve which more or less has completely gone out of control. Rahul Shrivastava, National Affairs Editor, India Today, joining us. Rahul, the situation right now seems to be completely out of control. The health infrastructure crumbling, and after a lot of criticism, it has jolted both the government at the center and at the states into action. The Prime Minister now himself trying to take charge.
Ankit, your audio is having some problems, but I assume you are talking about how there is a huge crisis, and perhaps now there is a retake. Yes, I think the central government, the state government, they were having their own administrative tussles, one-upmanship and blame proportioning. On the other hand, there was a crisis brewing, and there was a sense of complacence. And there was no coordination, there was no preparation, and there was nothing done to really meet a situation which should have been assessed and prepared for. But it seems now there is some amount of sanity, or perhaps we can say a knee-jerk reaction, which is visible. First very important element, that the Prime Minister, initially he was supposed to have rallies, 2 on the 22nd, 2 on the 24th in Bengal. Given the kind of public outcry which came in, the BJP had initially decided that he'll be having the rallies all clubbed on the 23rd. Now those rallies are off, public pressure seems to have worked, and the Prime Minister will not be campaigning in Bengal tomorrow. Importantly,
right,
perhaps in a sense to display a
Rahul,
sense of urgency,
yes,
and that the Prime Minister is at it. Now a schedule has been announced in which the Prime Minister, what he will be doing all of Friday instead of campaigning is here. Now what we are being told is that he'll be holding a meeting at 9 a.m. related to situation on COVID-19. It will be an internal meeting. At 10 a.m. the Prime Minister will interact with chief ministers,
yes,
of high burden states on the COVID situation. That means some 12-odd states. At 12:30 p.m. he'll hold a meeting with leading oxygen,
yes,
manufacturers via video conferencing. Now, if you see what is happening,
Rahul,
it's a very clear indication
Rahul,
that a signal is being sent across,
yes,
that the Prime Minister is at it.
Yeah, Rahul, but the argument, of course, would be, but this also comes at a time when the government of India, more or less in February, said that we have had some kind of a victory over coronavirus. You are right that the public pressure is working, but is it the Prime Minister now coming into action as we speak because there is so much hue and cry? What is the government's assessment of the current crisis at hand? Why was it that they were not able to anticipate?
Ankit, what one can say is that right now, whatever is visible is coming after there has been a huge spurt. So what one can say is, it's lot of it is delayed action or more of delayed reaction. I think the fall in numbers since November last year, and also I think keeping in view that any kind of a signal that the government is preparing for large numbers, its economic impact, and also importantly, Ankit, impact on campaigning. If the central government had raised red flags, do you think those road shows and those rallies with large numbers could have been held? I don't think so. So I think kind of a lull eventually got built up because of these perceptions. And I think the state government, the district machinery, the babus, everyone was equally participant in the creating this situation. And eventually when the numbers surged, then everybody seems to be galvanizing, writing letters, demanding oxygen, demanding vaccination. Remember, there were politicians who were talking that how the veracity or the efficacy of the vaccines is doubtful. Today they are talking about vaccinating everybody. So we can paint the entire spectrum of politicians, state government, central government with the same brush right now. One important point, I think the central government was wary of the criticism it faced after enforcing lockdown without consulting people. And that's why it has not jumped in. It is only after the numbers have gone up that the center has stepped in.
You know, very well made points, Rahul. And the complacency, to say the least, of the central government and the state governments has cost many lives. And the entire country is in distress. There is absolutely no hesitation to say that last few weeks have been desperate, distressful, situation only getting worse. And even at that point of time, initially we saw political parties only talking about elections. That accountability has to be fixed.